Welcome to you all. I'm going to give you a short presentation starting quite simply with the three converging megatrends driving the transformation of healthcare. And in the middle, there is, that's common ground, of course, P for medicine. And we are within the project, of course, is Digimed Bayern. The slide is quite familiar to you, so I will skip it and forward to the next slide. And the next slide is quite an impression on how is the evolution of data regimes, which start on individual or small test cohorts and forward at the end of the day to the last state, and which has been realized, as Professor Schungert had already pointed out, in Digimed Bayern. And it's all about, of course, with big data. And big data is not only the volume, it's not only the variety, but is also it has an effect on the experimentation design of medical research. So we are now in a stage which is best to describe as an attempt to describe and probe unknown workings of complex systems. In other words, if we can measure it, maybe we can understand it. That's, of course, what we would call a hypothesis-free approach. This hypothesis-free approach is quite common in current medical research, as far as I know, at least. But it, of course, must not be separated or considered separately from the classical methodology of priori hypothesis. In other words, we have here at play a synergistic cycle of hypothesis-driven and data-driven experimentation. Now, what are the barriers in this regard? Barriers are first, of course, factual barriers. So to speak, the pre-big data IT landscape, which has to be overcome also in this project. We've got many multiple data sources Professor Schungert spoke about. We've got a siloing of health data, and with, of course, in general, at least, we had a lack of centralized repositories, and of course there is an access problem, and this access problem is depicted also, of course, by legal barriers which are mainly enshrined in the General Data Protection Regulation. That's a regulation that is in effect since May 2018, and it is concerned, it involves all studies performed by EU, EEA institutes, companies, and or EU citizens. So the scope, personal scope, is rather broad. There's only one exception, and this is anonymized data. In principle, and this is what we also need within Digimed Bayern, a data sharing agreement, which is, of course, done by law. And when it comes to research, it must be quite clear, or it should be pointed out, that we've got only limited research exemptions laid down, for example, in recital 33 of the GDPR. Now, when we are talking on legal barriers, the main barrier is, and that's quite clear, the explicit informed data processing consent of patients you need normally. And this consent is limited to specific purposes. That's the so-called principle of purpose limitation. And what's the state of the art in Germany? The state of the art in Germany, we are not talking, of course, of data which stem from statutory insurance bodies, which have been also used in this project. We are talking on simple patient data. And the state of the art in Germany is we've got a broad consenting principle. That is, the consent is relating to medical research to improve the identification, the treatment, and the prevention of disease. A rather broad consent, but the issue is whether this is in accordance to the principle of purpose limitation. So it come into play by the MII, which had, after a struggle of 2 years or so, an agreement, or at last an approval, you might call it an approval by the Federal Data Commissioner, as well as the state data commissioners, and they are in the last, at the end of the day, they're saying, oh, it's okay. There is such thing to be acknowledged as a broad consent. And that's, of course, a rather great or important progress from the viewpoint of medical researchers. And it has been indeed a massive relief to DigiMed Bayern. But I'm afraid there's sort of an elephant in the room. And this elephant in the room may be perhaps a game spoiler. And the game spoiler is the European Data Protection Body, and they have issued on the 2nd of February a document which is well, not very let's say optimistic when it comes to research. The phrase broad consent cannot be found either in the recital and or the GDPR. In other words, it's questionable. Is there anything as a broad consent? And they also put forward, it is therefore imperative that the research areas are narrowed down. So there's no broad consent, and they add, the GDPR cannot be interpreted to allow for a controller to navigate around the key principle of specifying purposes for which consent of the data subject is asked. So, they will issue more detailed guidelines in this year, so we will perhaps see clearer, but at any rate, it's sort of an elephant in the room, and well, it's of course only up to us to wait and see. And my major topic, I should turn to it at this point, is data donation, which may be perhaps regarded a loophole to this tricky situation. And what is data donation? A simplistic working definition would read as follows: an act of allowing to use one's personal data for medical research purposes. A more elaborated definition would read as act whereby people voluntarily contribute their own personal data that was generated for a different purpose to a collective data set. Of course, first, voluntarily, that's quite important. And the second one relates, of course, to the issue of secondary research use of patient data, which is done, of course, within this project. The underlying theories is, for example, solidarity. In this regard, this means an interpersonal solidarity, which is the domain which is characterized by the manifestation of individual willingness to carry costs to assist others, quite simply. And another one would be the concept of data sovereignty. This would mean that sovereignty considered as personal sovereignty is not to be reduced to negative and predictive rights and powers, and it is in the GDPR, of course, mainly, but also encompassing positive entitlements to pursue one's notion of good life through connecting and interacting with others. So that's more, you may call it a communitarist view, which is partly based on gift theory. So what does this mean? Now, the end, of course, is that there are a recommendation of the facilitation of health data donation by legal means. So it is the idea, quite simply, to have a legal framework. And that's my next chapter, just to show you that there has something happened in good old Germany. And to put it quite simple, there is a legal basis for health data donation as of the 1st of January of 2023 at the latest. Some call it a sea change for the German healthcare system. Now, what is it about? It is the notion of donation is not depicted in the act itself, but in its explanatory memorandum, saying injured persons are given the opportunity to voluntarily make data from their electronic health records available to medical scientific research. Sounds pretty good. Now, what means injured persons? These are members of the statutory health insurance scheme, which count for 91% of the total population. The privately insured persons will follow next year. And the other thing is the connection to electronic health records, EHRs. These EHRs are also relatively new. They are available since the beginning of the years, and the patients are given access by an app, which could be downloaded, of course, and there they can give via the app their decision on different contents that may be doctors finding, diagnosis, therapy measures, therapeutic reports, medication schedules, blood values, and so on and so on. So donation, if you would classify or qualify it, is of course only data sharing. It's not to be juxtaposed with the typical donation of an organ, for example, for a simple reason that you stay owner of your data, or the data is related, at least. You won't get rid of it, of course. So what are the prerequisites of the donation? These are only limited research purposes, in particular a longitudinal analysis over longer periods of time, analysis of treatment processes, care research especially, and from the viewpoint of the patients, there's free choice as regards volume, as regards certain types of data and certain documents. And the patient must be preliminarily informed on the voluntariness of his or her donation, of possible uses, of the purposes, of the right of regulation. And behind that, there is a complex structure, which is, of course, someone which main characteristics is in principle the two organizations of data trust, the research data center and the trust center, and these are independent bodies under the surveillance of the Ministry of Health, and they will have only the opportunity to pseudonymize, to get pseudonymized data. In other words, even on the level of the single insurance bodies, the data have to be pseudonymized. So there's some data security and data protection in this. And now the question is, of course, how is the access of medical researchers organized? And they have only access to the data which are stored in the research data center. And there are some, of course, prerequisites of getting access. It's only a restricted user group, institutional care, universities, hospitals, of course, publicly funded non-university research institution, other institutions, but no private companies. The other access prerequisite is, of course, you have to apply for it. The addressee is the research data center, and you have to demonstrate the necessity of getting the data. And what is quite important from a researcher's perspective is the quality of data, of course. And as a rule, you will have them only anonymized and aggregated, but even with small numbers of cases, if this is justifiable. And under certain conditions, even you've got single pseudonymized data sets. There are a limitation of the donor's rights, that is the right of revocation, but it's in principle the same as it is in the GDPR. The data transmitted before revocation of consent already used for specific research projects may continue to be processed for these research projects, but there are no rights to erasure restriction of processing object as they are laid down in the GDPR. So there's a real limitation. The question is, of course, then, is there conformity with the GDPR? Well, that's rather contested among legal scholars. The assumption, quite simply, is that donation is nothing other but an informed consent within the meaning of the GDPR. And the other issue is there any leeway for member states in the area of research? Of course, there are some provisions in the GDPR, but the question is how far they reach. Now, just a short glimpse to the European landscape, and there's also a new development, the Data Governance Act, which is a proposal by the European Commission. It's another concept. It's a concept of data altruism, which is laid down there. Data altruism means the consent by data subjects to process personal data pertaining to them, or permissions of other data holders to allow the use of their non-personal data without seeking a reward. That's altruism, without seeking a reward, for purposes of general interest, for example, medical research. So what are the instruments to facilitate data altruism? And it's quite an astonishing instrument. That's a register of recognized data altruism organizations. Of course, there are only a few eligible organizations, legal entities constituted to meet objectives of general interest. and there must be not for profit basis, and this it must be also independent from any entity that operates on a for-profit basis, and internally there must also be an independent structure. And another instrument is a data altruism consent form, which of course may be adopted to single areas such as medical research. And all in all, of course, there's no deviation from GDPR. And what's really new is what we don't know, just look into the crystal ball, is the European health data space, where we expect another proposal of the European Commission in due time. What are my conclusions? And the main objective maybe is workability. Does this really work? Is there any willingness of health data donation? Well, a member of our advisory board says quite simply, yes, there's a great willingness to donate data, and of course there are also studies which making quite clear that there is broad consent to data donation for medical research, and Germans would share their health data with scientists at university, 97%. Yeah, that's great. And how long should, okay, there are some differences when it comes to the length of data usage, but in principle, it's a great thing. And it's not only theory, it's not all about theories, but we've got in more recent times success story with the RKA Corona Data Donation project. And we've there seen over 500,000 donors and 183 million of donated data. So apparently it works, and my conclusion quite simply is hope springs eternal in the human breast, also in the medical researchers' breast. And that's all what I could say. Thank you very much for your attention.